Hi there, my name's Nicole. I'm an occupational therapy student. Today I'm going to be going over joint range of motion exercises that you can do at home. Before I begin, I did want to touch on some possible precautions. If you're recovering from a cardiac surgery and your doctor's given you sternal precautions, you want to make sure that you're not pushing and pulling or lifting items of 10 pounds or greater, and you want to make sure that you're not raising your arms up above shoulder level. If you're recovering from a spinal injury or surgery, you want to make sure that you're not bending, lifting, or twisting, or reaching overhead. I did want to mention that for these exercises, we're going to be doing them from a seated position. First exercise we're going to be going over is shoulder flexion and extension. So for shoulder flexion, you're going to go ahead and have your arm dangle down by your side with your thumb facing upwards like you're giving a thumbs up. You're going to go ahead and raise your arm upwards towards the ceiling and back down. I'm going to show you shoulder extension from the side view. Okay, so again, with your arms dangled down and your thumb upwards, you're going to go ahead and raise your arm backwards as far as you can. During these exercises, it's important to make sure that you're not hunching your shoulders or leaning to the side, because you're not going to get the same benefit from the exercises. Something that you can do if you find that you can't do the exercises with your affected arm is you can use your unaffected arm or the uninjured arm in order to support yourself. So for shoulder flexion and extension, you're going to go ahead and lace your fingers together and rest them on your lap, and then go ahead and bring the affected arm up as far as you can to the ceiling and back down. Next exercise is shoulder internal and external rotation. So turning the shoulder joint inward towards the body and outwards away from the body. So what we're going to do for this one, we're going to go ahead and bring our elbows in and have our arms bend at about a 90-degree angle. For external rotation, or rotating the shoulder joint outwards, you're just going to go ahead and take your hands out to the side, making sure those elbows are inward. And for internal rotation, or bringing the shoulder joint inwards, you're going to go ahead and bring your hands in towards your stomach. So again, if you need help with this, what you can do is use the unaffected side to assist your affected or injured side. So again, you're going to keep that elbow in at a 90-degree angle, and you're going to go ahead and grab the wrist, and you're just going to go ahead and push it out for external rotation, and then go ahead and support it as you bring it inward for internal rotation. The next exercise we're going to talk about is shoulder abduction and adduction, or bringing the shoulder away from the body towards the side and back down to the body. So again, we're going to dangle our arm to the side with our thumb facing outwards, and we're going to go ahead and reach up the side, up to the ceiling as far as we can. That was abduction. And for adduction, or adding our arm back to our body, we're going to go ahead and just bring it down to the side. Again, if you find you can't do this on your own because of your affected or injured arm, you can go ahead and use your other arm in order to support it and do the exercises. So again, we're going to go ahead and we're going to actually use our wrists, and we're going to go ahead, it's like we're cradling a baby. So we're going to go ahead and abduct and adduct, just like that. Okay? The next exercise is elbow flexion and extension. So bending and straightening the elbow. Again, for this one, I'm going to show you from the side view. So again, we're going to have our arm straight down, and then we're going to have our thumbs up, and we're going to bend the elbow, which is flexion, and straighten the elbow, which is extension. Again, if you find that this is something that you're unable to do easily, you can use your other arm and assist like this, bending and straightening. So flexing and extending. The next exercise we're going to do is called forearm pronation and supination. And something that I like to think about when I think of pronation and supination is either palms up or down, or you're holding a bowl of soup in supination and you're pouring it in pronation. So this is gonna be palms up is supination, palms down is pronation. Again, if you find that you need some help, you can use the unaffected arm and intertwine it with the affected arm, and you can assist it in doing the supination and pronation. Okay, so the next exercise is called ulnar and radial deviation, which kind of looks like you're waving to somebody. So it's like this. Ready? You have ulnar deviation and radial deviation. So waving to the right and waving to your left. Again, if you find that you need help with this, something you can do is go ahead and support your hand, and you can go ulnar deviation, radial deviation, ulnar deviation, radial deviation. Okay, next we're gonna work on our wrist flexion and extension. Again, bending and straightening the wrist. So we've got wrist flexion and wrist extension. So bend the wrist and straighten the wrist. Again, if we need some help with that, you can take your unaffected hand and you can go ahead and assist by going flexion, extension, bending, straightening. Okay, and then what we're going to work on next is our hand range of motion. For our hand range of motion exercises, I wanted to move over to a table. So something that we can do for our hand range of motion exercises that covers a lot of the joints is making a fist. As you can see, we're bending at each joint. So you can straighten out your hand and you can bend your hand. Also, something that we can do is we can block off at the closest joint for our fingers, and we can go ahead and bend and straighten, bend and straighten. And then also what we can do is we can isolate the joints on each finger. So as you can see here, I'm gonna go ahead and block at the closest joint or the knuckle. We're gonna go ahead and bend and straighten, bend and straighten. And then I'm gonna move up to the next knuckle and I'm gonna block at that joint and go bend and straighten, bend and straighten. And then up to the furthest knuckle, again, bend and straighten, bend and straighten. And you're gonna wanna go ahead and do that with all 4 fingers. Your thumb is a little bit different. So for the thumb, we have this movement called opposition, where your thumb's able to oppose or reach all of the other fingers on our hand. So it looks a little like this. So you're opposing each finger. So additionally, what you can do for thumb opposition is you can go ahead and block at your CMC joint or that thumb knuckle that's closest to the body, and you can go ahead and oppose that joint. Again, if you're not able to do that on your own, what you could do is take the other hand and you can actually take it and help it oppose or reach each finger like this at the joint or at the finger. Just like the shoulder, we have that movement of adduction and abduction with the thumb, which is going to be bringing the thumb away and back to the hand. So we have thumb abduction, so bringing it away from the hand, and adduction, bringing it in towards it. Again, if you need some help with that, what you can do is take these 2 fingers and you can go ahead and you can use them to spread your thumb away from the hand and abduct, and then bring it back to an adduct. Again, using those fingers and spreading away and bringing the thumb back to. If there's any other questions that you may have, you can feel free to reach out to me. I'm gonna go ahead and make sure that I provide you with picture instructions, and then provide you with a routine for doing these exercises. So the frequency per each week, and then the repetitions that I'll need you to do. Okay, thank you.